Welcome back to our channel. Today, we're diving into an important health topic, the early signs of diabetes. Recognizing these symptoms early can make a huge difference in managing the condition effectively. Diabetes is a chronic condition affecting how your body regulates blood sugar, and it's important to be aware of the warning signs your body might be sending you. We'll be discussing 7 common early signs of diabetes that you should never ignore. So, stay tuned because this information could be crucial for you or someone you care about. One of the earliest signs of diabetes is increased urination, especially at night. This symptom is medically known as polyuria. When your blood sugar levels are high, your body tries to get rid of the excess sugar through your urine, and this can lead to more frequent trips to the bathroom, particularly noticeable during the night. If you find yourself waking up multiple times to pee, disrupting your sleep, it's essential not to brush it off. While frequent urination can be attributed to various factors, persistent nighttime bathroom visits should be a red flag to get your blood sugar checked. Early detection is key in managing diabetes effectively. Have you been feeling excessively thirsty lately? Like you can't quench your thirst no matter how much you drink? This insatiable thirst, known as polydipsia, is another telltale sign of high blood sugar. When you're frequently urinating due to high blood sugar, your body loses more fluids, leading to dehydration and that constant feeling of thirst. And it's like a vicious cycle. High blood sugar leads to increased urination, which then leads to dehydration and excessive thirst. If you're reaching for your water bottle more often than usual and your thirst feels unquenchable, it's crucial to pay attention to this sign and consult a healthcare professional. Now, while many people might welcome weight loss, especially if they have been trying to shed a few pounds, it's important to understand that not all weight loss is beneficial or healthy. Losing weight without any changes in your diet or exercise routine can be a red flag, signaling that something might be wrong with your health. This is particularly concerning in the context of diabetes, a condition that affects how your body processes blood sugar. Unexplained weight loss occurs because your body isn't able to use glucose or sugar for energy as efficiently as it should when you have diabetes. This inefficiency happens because the glucose remains in your bloodstream instead of being used by your cells. Insulin, the hormone responsible for helping your cells absorb glucose, is either insufficient or not working properly. In type 1 diabetes, the body doesn't produce enough insulin, while in type 2 diabetes, the body becomes resistant to insulin's effects. As a result, your body starts breaking down muscle mass and fat stores for energy, leading to weight loss. This process is your body's way of compensating for the lack of usable glucose. If you notice the numbers on the scale dropping without any effort on your part, it can be alarming and confusing. Don't just celebrate just yet. While it might seem like a positive change, it's essential to understand the underlying cause of this weight loss. It's crucial to rule out diabetes as a potential cause. Consulting with a healthcare professional can help determine if diabetes or another health issue is behind your unexplained weight loss. They may recommend blood tests to check your blood sugar levels and other diagnostic tests to get to the root of the problem. Early detection and management of diabetes can prevent further complications and help you maintain a healthy weight. So, if you experience unexplained weight loss, don't ignore it. Seek medical advice to ensure your health is on the right track. Remember, your health is paramount, and understanding the reasons behind sudden changes in your body can lead to better outcomes and peace of mind. Chapter 4. Extreme hunger. Are you constantly feeling hungry, even after eating a satisfying meal? This feeling of never being full can be incredibly frustrating and confusing. This insatiable hunger, known as polyphagia, is another sign that your body might not be utilizing glucose properly. Glucose is the primary source of energy for your cells, and when it doesn't reach them, your body reacts. When your cells don't receive enough glucose for energy, they send signals to your brain, triggering hunger pangs. This is your body's way of telling you that it needs more fuel, even if you've just eaten. You might find yourself craving sugary foods as your body tries to get quick energy, but this can further exacerbate the problem. Sugary foods provide a rapid spike in blood sugar, but this is often followed by a crash, leading to more hunger. It's a frustrating cycle. You eat, but your cells aren't getting the energy they need, so you feel hungry again shortly after. This can lead to overeating and weight gain, which can further complicate your health. Along with constant hunger, you might also feel weak and tired, struggling to get through your daily tasks. This is because your body isn't getting the energy it needs to function properly. Persistent, unexplained hunger can be a sign of diabetes, a condition where your body either doesn't produce enough insulin or can't use it effectively. Insulin is a hormone that helps glucose enter your cells. Managing your diet and making healthy lifestyle choices can help regulate your blood sugar levels and reduce feelings of extreme hunger. Eating balanced meals with a mix of protein, fiber, and healthy fats can keep you fuller for longer. If you're experiencing persistent, unexplained hunger, it's essential to consult your doctor to rule out diabetes or other underlying health conditions. Early diagnosis and treatment can help manage symptoms and improve your quality of life. Remember, understanding your body's signals and seeking medical advice when needed is crucial for maintaining your health and well-being. Don't ignore persistent hunger. It could be your body's way of telling you something important. Chapter 5. Fatigue. Feeling constantly tired and lacking energy even after a good night's sleep. This fatigue is a common symptom of diabetes, and it's directly related to your body's inability to use glucose for energy efficiently. When your cells don't receive the glucose they need, it's like running a car on fumes. You might feel sluggish, weak, and find it difficult to perform everyday tasks. This fatigue can be persistent and interfere with your work, social life, and overall quality of life. If you're experiencing unexplained fatigue that's affecting your daily routine, it's essential to consult a healthcare professional. Chapter 6. Blurry Vision. Have you noticed your vision becoming blurry or distorted lately? This can be a disconcerting experience, making everyday tasks like reading, driving, or even recognizing faces challenging. High blood sugar levels can affect your vision, and this is a symptom you should never ignore. Elevated blood sugar can lead to a range of eye problems, from temporary blurriness to more severe conditions. When your blood sugar is high, it can cause the lens of your eye to swell, leading to blurry vision. This swelling changes the shape of the lens, making it difficult for your eyes to focus properly. This blurriness can fluctuate depending on your blood sugar levels, and it might improve when your blood sugar is well managed. However, it's important to monitor these changes closely, as they can be indicative of underlying issues. However, if left untreated, high blood sugar can damage the tiny blood vessels in your retina, the back of your eye, leading to diabetic retinopathy, a serious eye condition that can cause vision loss. Diabetic retinopathy progresses through stages, starting with mild symptoms and potentially leading to severe vision impairment. If you experience any sudden changes in your vision, it's crucial to seek immediate medical attention. Early detection and treatment are key to preventing long-term damage. Regular eye exams are essential for anyone with diabetes, as they can help catch problems early before they become more serious. During an eye exam, your doctor can check for signs of swelling, damage to the blood vessels, and other issues that might be affecting your vision. They can also provide guidance on how to manage your blood sugar levels to protect your eye health. Managing your blood sugar through a healthy diet, regular exercise, and medication if needed is crucial for maintaining good vision. By keeping your blood sugar levels in check, you can reduce the risk of developing serious eye conditions. Support from healthcare professionals, family, and friends can also make a big difference. Joining a support group for people with diabetes can provide valuable insights and encouragement as you navigate the challenges of managing your condition. Remember, taking proactive steps to manage your diabetes can help you maintain clear vision and overall eye health. Don't hesitate to reach out for help and make use of the resources available to you. Your vision is precious, and with the right care, you can protect it for years to come. Chapter 7. Slow healing sores or frequent infections. Are you noticing cuts, sores, or infections that seem to take forever to heal? High blood sugar can impair your body's ability to heal and fight off infections, making you more susceptible to slow healing wounds and frequent infections. High blood sugar levels provide a breeding ground for bacteria and fungi, increasing your risk of developing skin infections, urinary tract infections, yeast infections, and other types of infections. If you're experiencing recurrent infections or wounds that are slow to heal, it's essential to consult your healthcare provider to address the underlying issue. Don't ignore the signs. If you or someone you know is experiencing any of these symptoms, it's important to consult a healthcare professional. Early detection and management can make a significant difference. Remember, these symptoms might not always indicate diabetes, but it's always best to err on the side of caution and get checked out. Don't forget to like, share, and subscribe for more health tips and information. Stay healthy.